Hi, welcome back to the Millennials for Myo podcast. Thanks for joining us. So, last episode we talked about, you know, uh, reoccurring issues in your health and how it shouldn't be a consistent issue. So, things such as snoring and how to correct that, and things to look for, and things such as ear infections. So, in this episode, actually, we're going to relate it in a similar way to dental health and dental indicators, which Haley's going to do an awesome job diving into and explaining a bit more in detail about those.
Awesome. Thanks, Marley. I'm going to go ahead and get right into these dental indicators. These are things that we note.
Yeah.
And most times, not a ton of parents always come in, like, are in the room, but usually at the end, they're like, so how was it? How'd the treatment go? Anything like that. And even in my practice, like, there's hygienists who are like, so what am I looking for exactly?
Mm-hmm.
And it's hard because it's not just one thing. You're not like, oh, like their dental alignment or their bite or their teeth, they're not perfectly straight. Yes. Okay. Is that a sign? Is that a symptom? In some cases, yes. In all cases, no. But usually, yes. And then the noxious habits, like I said, that's the very first question that I always ask parents is like, how is their sleep? Are they breathing through their mouth when they sleep? Are they breathing through their mouth like when they're sitting on the couch watching a movie, when they're sitting at home doing Zoom school? Because we all just did it for a year. So don't tell me you didn't look at your kids sitting on the computer.
Mm-hmm.
And like I've even asked a few parents, like, hey, like look through your pictures from the last 6 months. Like you've been sitting at home doing distance learning. I bet someone has taken a picture in your household if you have more than one kid. Like at least I come home from my nieces and nephews' houses and like there's 15 new pictures on my phone,
Nice.
minimum.
Yeah. You're like assessing them as
And
you go.
literally, I'm like zooming in, like,
Yeah.
actually, it's all my friends' kids. I'm always like, and where's their tongue?
Yeah. Totally. Yeah.
And so, like, one of the easiest ones that I always can just be like, okay, look for these things: enlarged tonsils. Usually, when dentists are coming in doing exams, at least my dentists like to give us the grade of their tonsils so that we're monitoring it basically throughout their life or throughout the time that they're seeing us. But I have just great doctors that are super thorough, and not everyone maybe will say that or write it in their notes or have it where it's actually monitored. If they notice, yes, oh my gosh, these tonsils are huge, enlarged tonsils. But if it's kind of something that's, oh, every time they come in, enlarged tonsils, I'm even guilty for it, for being like, oh, that's just their normal.
Mm-hmm.
But we have to get out of the realm of thinking all of these other things are normal. And so when discussing that, they were like, well, is there anything else? Like, I mean, tonsils could be this, could be that, could be something else. And it's totally, it could be they have a cold. It could be like a tonsil stone. And so I'm always suggesting like running your finger across the roof of their palate. Do they have tori? Are they clenching or grinding? And like these are just factors, assessing the muscles, feeling their masseter muscles and their lateral pterygoids, and asking them questions and asking them to monitor themselves, or maybe mobility. Like I have noticed so much mobility on people that shouldn't have it. And lots of the times the cause is maybe an ill-fitting Brux guard
Mm-hmm.
or an ill-fitting retainer or something that's putting pressure. And then when they're clenching and grinding, it's creating this trauma to the tooth. And when that happens, it turns not so nice. And then your tooth gets really mad
Yeah.
because just like anything else that has trauma done to it.
Good
But
point.
that's
Yeah.
just very simple things that like I bring up mostly in kind of social conversations with them, um, more so than trying to ask these questions specifically, because people will tell you their habits without even knowing that they're telling you their habits.
Yeah. And again, I'm not in the dental field, but when you are relaying this information to the parents, for example, after you see their kid, like you can tell them, when their mouth is wide open, you get a great view of everything. So if you're looking at their palate, like the roof of the mouth, is it is it narrow? Is it
Mhm.
high and vaulted? Um, so I feel like again, this episode always circles back to correct oral rest posture. If you notice that,
I think that's myofunctional therapy in general.
yes, for sure. Like if their palate is high and narrow, there's no way that they're resting their tongue up in the roof of the mouth. It is down and low, and it's not providing that support. So your tongue is your natural expander, right? If it's up there, it's going to keep your teeth all in line. And your
It's
lips,
basically your natural
yeah,
appliance.
and your lips are your natural braces. If your lips are closed, it's going to keep your teeth looking nice and straight behind your closed lips. It's going to provide that support that it needs. And on that note too, like if their tongue is resting low, it could lead to teeth crowding, which you probably know a lot more about in your field, but I see it all the time. If your tongue is not in the correct place, your teeth are going to get crowded, and then it leads to things like, oh, or like there's not enough space now and you actually have to get teeth pulled, and like it's a mess.
Well, and everyone loves to blame the wisdom teeth.
Right. Oh my
It's like,
goodness.
well, it was perfect, but my wisdom teeth came in and it crowded everything together.
Yeah, no,
And
I've
that's
seen teeth
since been
crowding in kids
disproved.
of like 7 years old before wisdom
Yeah.
teeth, so like no.
Yeah. It's like, because it's always people who have had braces, right? They're
Hmm.
like, well, I don't want my wisdom teeth to wreck my teeth. And it's like, well, technically they shouldn't. Like technically, in everything that I've read and found and researched, that shouldn't be happening.
Yes.
Can they cause issues like infections and cysts and decay and abscesses? Yes, for sure. Can they be covered by like a muscle that makes it really hard to brush? For sure. But realistically, it shouldn't move your teeth around.
Yeah. And then my mind goes into a whole other tangent that we won't get into today, but it is related to the wisdom teeth because you're reading the same book, the Jaws book, right, Haley? And so
Mhm.
like our ancestors, like pre-industrial revolution, like why do you think they never had any issues with their wisdom teeth? They didn't have braces back then. They didn't have anything because they had the proper muscle
Nasal
functioning
breathing.
based on the foods they were eating and the chewing they were required to do. They actually had all their teeth, their wisdom teeth, and nothing was
And they
impacted.
were perfect.
Yeah, everything was perfect skulls, perfect teeth, like all that stuff. So
Could you imagine trying to drill into one of those teeth?
I can't because I've never even drilled into any of these
Well,
any
that
teeth.
is fair. But like, I don't know, like because the products in dentistry are changing, like for crowns and bridges and stuff, and they're getting a lot stronger. And I overheard a conversation that was like, wow, like I had never experienced something that was this strong. Like I'm using my diamond and it's not even cutting. And instantly I was like, hmm, I wonder
Mm-hmm.
if the strength of our teeth, like the literal, just the strength of our enamel from then to now, especially with the amount of acid that we consume now,
Yeah.
because that's really what eats away your enamel. That's the biggest thing. And like the First Nations who were here pre us, like they weren't eating oranges and kiwis and that kind of stuff. Like they just weren't.
Yeah. That's where my mind went, was the acidic foods. Yeah. It's it's a lot. Everything's a lot. And I'm
Everything's a
just like,
lot.
I'm staring at, I'm like, we could go down a whole rabbit hole. And I'm like, okay, but
We
also
could
back to
literally be on this
tonsils.
podcast for like
Because
hours.
tonsils, so I just want to talk about like the vicious cycle of tonsils. So if they are enlarged and you notice them, and like you said, if it's each visit that they're coming to see you and their mouth is open and you see these huge tonsils at the back, or even the tonsils that you can't see visually, but you can get a scan and see, it's caused by mouth breathing. So if you have large tonsils, it makes it hard to breathe through your nose. And so then you're going to keep breathing through your mouth, which is going to continuously enlarge those tonsils. And it's just like a never ending cycle, where then we would refer out and say, like, you need to see where the like which tonsils are affecting your airway
Mm-hmm.
and deal with that, because then it's like I've seen kids go through tonsillectomy and then
Mm-hmm.
magically they can breathe through their nose again, and it's like, great, now we can work on nasal breathing and you are in the right place. So the other thing is, okay, so there's a slew of information about, oral rest posture. There's tons of stuff you look at as a dental hygienist in terms of inside the mouth, but also
Mm-hmm.
parents can look out for, and if you have like family visits with your doctor, they're also behavioral observations that you can look at,
Mm-hmm.
like look at your child. If they have an ADHD diagnosis, again, it goes back to their quality of sleep. If they're breathing through their
Yes.
mouth, there is research showing that,
Is their brain getting enough oxygen?
yeah, I've seen research that a lot of children who are diagnosed with ADHD have actually, it's been linked to their mouth breathing. And then they go
Mm-hmm.
through myofunctional therapy. And once they correct the mouth breathing, their behavior improves significantly. And it's kind of heartbreaking because these poor kids, they struggle academically. They
Yeah.
can't pay
And
attention.
socially.
Yeah, they can't focus. And socially too, it's just like they seem sometimes just like all over the place. They seem like just like quote unquote like the bad kids. But the poor guys, like they don't
Like
know.
actually awesome.
Yeah,
They
they're
just
just
don't know where to put their energy.
exactly. They're just trying their best to make it through the day with their whatever sleep that they got the night before. And then even after they correct their breathing, so they're now nose breathing, their grades improve. Like it is just so, it's sad, but it's also inspiring. So like this is again our hope of like getting this information out there. Again, going back to medication, like so now these poor kids have been on medication for ADHD, and the whole time it was not even, like it's just like the band-aid. They're medicated
It
for their
wasn't the issue.
behavior, but
Yeah.
it's like, okay, change the function of your breathing and you don't need to take medication. Like this is what we're trying to get away from. So prevention, not,
Prevention over intervention.
yeah, yeah. It's wild.
It's wild. The myofunctional world is wild, and you guys should all stay tuned for our next episode because more of this silliness will continue.
Yeah.
And we just want to leave you guys with some general observations that you can see in your kids, you can see in yourself. And we'll just quickly run through these and probably tangent a little bit more.
Yeah, we're good at tangenting. And so some observations again, aside from behaviors of kids, is you eat with your kid. Every mom and dad, you know, you've seen your child eat. So what you
Or
can,
you have a dog that sits right beside one of the children. And we all know that there's that one kid that the dog's sitting by.
yeah. And the
It's in our
reason
house.
is the dog is hoping this kid is going to drop a whole bunch of food and they get to
And they do.
lick it right up. So
Yeah.
messy eating is something that everyone can look up. And obviously this is, babies are messy.
Not
Yeah.
yeah, not like we're throwing things on the floor, like just the general child who you're constantly like, close your mouth.
Yes. So if there's food all over their face, down their shirt, all over the table, if they're messy, um, it could be that they don't have the muscle function to control the food that's in their mouth. Their lips might be open when they're chewing and stuff is just flying out. Their cheeks aren't suctioning properly to keep the food in, and it's just falling all over the place. The other thing is, it could be related to, what was I going to say? So, tongue thrust, right? If you see
Yeah.
their tongue is pushing the food out, that's another topic for also maybe another day. But tongue thrust, when your tongue is pushing forward on your teeth, sometimes the food comes out, could be related to tongue tie also, but not just messy eating. But if your kid is also a picky eater, if there's like very few foods that they
They will
they
eat.
will eat,
Or if they don't like to combine textures.
yeah, there's got to be a
Like,
reason. Is it control? Um, is it just they had a bad experience one time and they almost choked because they couldn't control the food, so now they totally avoid all that food. And
Or kids who demand their food be cut up all the time.
yeah, yeah,
Like
again,
my
free
nephew's a year and a
ingestible.
half and he loves to chew. Like it's like one of his favorite things.
Yeah,
We thought it was a teething thing. I don't know.
yeah,
He would prefer to get like the whole cucumber and like chew, 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 then get slices of it. Whereas my other kind of nieces and nephews that I've been interacting with, they would prefer it to be like cut up and like finger sized.
yeah, because then it's less of a risk in their mind. But
Mm-hmm.
life wasn't always like that. Like, we have the skills to chew. It's just, the way that our lives have gotten more towards softer and softer foods has led to issues with managing the foods.
Yeah, because our muscles are
Yeah,
not, they're just not formed to the point that they need to be.
yeah. So
And
just to kind of wrap this up too, so eating is obviously something you can look out for. And then an even younger kiddo, so like babies,
like
infants,
babies.
if there's ever been difficulty breastfeeding, difficulty sleeping again, or any, extended prolonged use of pacifiers is a huge one for me because I see it a lot too, like in speech. And you should think about, you ideally want to start weaning your kid from the pacifier at 6 months. And even before 6 months of age, you really should only be using it to provide a calming, soothing environment to make the baby feel like happy again. But if the baby's not crying, not stressed out or anything, they're just like
Sitting
laying
there,
there.
hanging
I
out.
know, like maybe they can't even sit yet. Like I don't know, but like they're just like hanging out there. There's no
I
reason
always
to
call
just
it the
like,
potato stage.
I've seen
Like they're
so
just being
many.
a potato.
We're like taught. I'm very excited about this point, but like,
Just got to get through it.
yeah, I know this definitely took a lot longer than we had planned for. But I mean, I love it because it goes to show you how complex everything is, and there's no like,
Well, and how much we love it. Like,
yeah, there's no solid answer for everything, but it's just like, here's a whole bunch of stuff you can look out for and some reasons why. Um, but anyway,
yeah, and some opinions that we have found.
yeah, like I've seen so many parents, so many moms who just like, you just like shove the pacifier in. But I'm like,
Mm-hmm.
nothing, they were just doing nothing. They're so it's going to impact their speech, it's going to impact their rest posture, which we now know rest posture is a huge, huge, huge component. Not even component. This is just like, it is what it is. This is what myofunctional therapy
Bases around.
bases
This is
around.
this is like the center of the universe.
Yeah. Because if the pacifier's in there, their tongue is down. And then creates
Yeah,
an open bite. And then we go back to our dental indicators and all of those things. And so
and it just
it
snowballs.
snowballs totally.
I was reading somewhere. I'm unsure if it was like a research article or if it was in one of the books that I'm reading because my brain's all over the map. But it was saying 21 days is how long it takes for a new suction to be formed with a pacifier. And I was just like, oh,
Mm-hmm.
that it's wild how short of a time because like you would think with the indicators of like you should take it away at like 6 months, you would think it would take that amount of time. Or even just in the cell turnover in your mouth, I'm pretty sure is at least 90 days. And so it was just shocking to me how short of a time it takes for your basically lip competency to form around that suction and create that suction to that soother.
The other thing that I've been reading a little bit more about and have been seeing is colicky babies. So, like you bring your new baby to their doctor checkup and they're like, oh, like they're fussy all the time, they're crying, like screaming bloody murder. And the doctor's like, oh, you just have a colicky baby.
And I hate when like no one gives them like some solutions.
Yeah. So what I
Like you have a colicky baby, go home.
Yeah. But we have to remember, like, again, this is the communication perspective coming out of me now is like crying is the baby's first form of communication to tell you that something's up, something's wrong, figure me out, check me, like if it's not a diaper, I'm not hungry, like all of those things. Okay, well, like they're
Mm-hmm.
uncomfortable, something is going on. And so it could be a tongue tie, for example, that has
Yes.
gone like it's been brushed off. Um, but it's pretty
Yeah.
much,
And you notice that so often right now. No one wants to snip a tongue tie.
yeah, yeah. So I mean, the thing is, colic, colicky babies having colic is a symptom. So the fact that doctors are diagnosing babies
Yeah.
as colic and that's the end of the story is like unfair.
Yeah. Like what's causing it?
Yeah.
Because I mean, like we went through GERD, gastroesophageal reflux disorder, I believe
Mhm.
is what it's called, with my nephew. And it was literally, we could not get this kid quiet for more than about 45 minutes at a time. And if you could, his sleep wasn't settled.
Mhm.
And you could just tell that something was up. And when he would cry, you would get that instinctual like he's hurt, like when you hear that hurt cry. And like moms always talk about the hurt cry, and like I didn't ever really notice it until I spent prolonged periods of time. And we were at the chiropractor, we went to two different family doctors all over the place. And I mean, we tried the gripe water, we tried oval, and it worked for some time. But then I started to notice when he didn't have his soother in his mouth, he had a little tongue poking out in between his
Mm.
lips. And the more and more I see pictures and videos, I'm like, that stinking little stinker has a tongue thrust.
Yeah. Just crazy. You don't know till you know, right?
And like, he was like a year old when I took my extended myofunctional course. And all of a sudden, I was like scrolling through pictures and videos and zooming in because it was like I noticed something was weird
Mhm.
or up or just different, but I couldn't figure it out. I couldn't figure out where it was coming from.
Yeah.
So like I think sometimes a GI referral in myofunctional or in breastfeeding therapy or latch therapy or anything like that with doulas when they're talking, because any doula that I've kind of talked to, usually, especially if it's a first time mom, they kind of stay in contact and help out. And if you need something or if something goes wrong or whatever, like sometimes it may be a GI thing. We may need to give that referral or suggest that option so that it gets looked into,
Yeah.
because it's not always just it's colic.
Right.
Like
And we're not saying every single time this baby's behaving like, is colicky. It's not always
no,
tongue tie, but it's just the idea is it could be gastrointestinal, like you're saying. And at the bottom line, you just got to,
just something to look at. It
yeah,
could be a
like look for your providers and see like what is the answer for your specific baby. Um,
mhm.
and then just on that, so general observations again, just finally, you talk to your kid if they're at the talking age. So we're kind of getting away from infants now and all of those issues. But when you're talking to your kid, you are noticing their speech. And so if they have any speech errors, so research shows that all children should have mastered and achieved all speech sounds by 6 years of age. So if your kid is 6 or older and you're noticing like, still struggling with the S sound or, their R sound a bit funny, like it's definitely a good time to look at an evaluation for that too. Um, because like I've worked with many kids who it's not just speech, but it's the underlying myofunctional issues
issues
that I work with hand in hand. So I'm doing a little bit of myo to train the tongue to be able to do the speech sounds.
to make the
Yeah.
sound.
So now that, we're kind of going to wrap this up, but that was a lot of information. And it just goes to show you that, like,
especially kids, but I like kids is where you want to get it because kids are still growing, and what you're doing and how you're changing those muscles and getting them back into their proper function when they're growing, they can grow properly.
yeah,
And so, like for parents and adults, I find you can treat usually more symptom wise, whereas this you can treat more functionally.
yeah. So in terms of prevention, that's a good point. Like, we don't start traditional myofunctional therapy with kids until they're at least 4 years old, because cognitively they don't have that awareness piece yet. So in terms of prevention, it's like from the 0 to 3 population. You're looking at things like we talked about today, like, issues breastfeeding, colic, tongue tie, all those kinds of things. And then so if things persist or they haven't sought help and now it's catching up and they're 4 years old, that's when we notice, okay, well, like, of course, like, look at their mouth, it's wide open, and they're mouth breathers, and they can't even dissociate their tongue from their jaw, and it's just like it could be a mess. So that's what I have to say about, starting myofunctional therapy. And then for those people who never did that and then they grow into adults, this is where we're going to be like, stay tuned for our next episode, because we're going to talk about what happens when you don't go through early intervention, you're not catching these things, and then you're an adult now and you're still suffering, and what that kind of looks like and where it leads into, and how us as therapists kind of address that, and what we do to help the
Or
patient.
what we can do or what we can help with.
Exactly, to correct again. But so, any final notes or thoughts? But I think we covered a lot, and we'll just, our next episode.
Yeah, we gave you guys a lot of information. So
Yeah,
stay tuned, listen again, share, subscribe, like do all the things that you need to do to hear more from us.
yeah,
But that's all we have to say on the kids topic for now. Of course, I'm sure we will be chatting children more and more and more because that's where we like to be.
for sure. So thanks everyone for listening, and see you next time.
Yeah, have a good day. Enjoy your life. Live your best life.
Bye.